chiropractor here at Hometown Integrated Medicine, and I'm here today with my patient Jeremie. Jeremie is a drummer in his band. He travels a lot for work, and so typically we work on his neck and upper back and fixing that a little bit. He's sleeping in a different bed pretty much every week. So Jeremie, what has been going on since I saw you last?
Well, I've been having a lot of problems with some mobility and some pain issues. Like you said, I sleep in a different bed every week, so having to kind of contort my body and then waking up in strange places and the jolts and the jerks and not knowing where you're at sometimes adds to a lot of the stress that I think I feel as well.
Okay.
So having that and then just having you guys work out on that and being a good partner like you guys are, it really helps me out.
Okay, awesome. Well, let's get started.
Okay.
What we typically find with Jeremie, especially in his neck and upper back, is that his shoulder blades actually play a really large part in why all of that is so tense. He typically has lateral scapulas, or his shoulder blades move too far out this way, putting tension on all of the musculature that's up here, and it creates a lot of pain. It also pulls a lot of his ribs in the associated area out of place too. So we do a lot of rhythmic adjusting, putting those ribs back where they should go. I like to follow the rib a lot further out and around the body than a lot of practitioners. I do find a lot of fascial adhesions along the ribs, and sometimes it'll stick them together, really pinching some of the nerves that are in between the ribs and those intercostal muscles, and it makes everything really angry, and sometimes even breathing gets a little tough too. You know you have a rib issue if you take a deep breath in or a deep breath out and you feel pain in those moments. How you doing, Jeremie?
Good.
Good. Just feeling for that fixation where things aren't moving so well, figuring out what direction it's not moving, what tissue or muscles might also have some overactivation. Now we're getting up into the part of the back where those the rib cage and the scapulas are probably playing a bigger role into the tightness. So I'm going to start to take a look at those. Our rib cage is supposed to provide us with a lot of stability and support, where our shoulders give us more mobility to do things. And when our shoulders get stuck and become our stabilizing area, our rib cage starts to become our mobilization area, and we don't want that because that's what creates a lot of unequal tension and can create pain in the area. So our goal is to get those shoulders moving again and those ribs stabilized to decrease our tension and pain. Good. Getting that first and second rib move back down. When we have our shoulders and we're nice and tense up to our ears, it pulls those first ribs up and out of place. Perfect. Good. All right, I think it's time to do some muscle work. So Jeremie, like we were talking about before, typically has some lateral shoulder blades, and when that happens, it pulls a lot on this musculature that's really close to the spines in here. And Jeremie has actually had proof of a rhomboid tear in the past that has had trouble healing. So we do a lot of kind of work up and through here. With his recent travels, his levator scapula muscles have also been a little bit angry, so we do a good amount of work up into here. And then even though these muscles are in the back, the upper back, they do have a tremendous influence on what goes on in the neck. And Jeremie is complaining of some pinching and pulling that goes on with certain directions that he's looking. So we're going to fine tune our muscle work to help relieve some of that.
You just sank my battleship right there. Good Lord, that was the first shot.
I can tell that this is more of a chronic problem for Jeremie too. When we go along these muscles and some of these patterns of the fascia that he has going on, it almost takes on like a cystic kind of feeling or a bubbly kind of feeling. And you know that that's just that constant tension getting pulled, those fibers getting pulled apart, and it makes for some unfun pain, doesn't it, Jeremie?
Necessary, but thank you.
Necessary evil right here. I'll move over to the other side here. Do a little bit of lat work. Also some work on the serratus anterior, a little bit deeper in the armpit area here. Those two muscle groups are kind of being overworked and overstretched a little bit, keeping this scapula, this shoulder blade here, too far off to the side. So we want to do a little bit of work to release that as well. Really trying to get my fingers in between the heads of the ribs in here. Try to break up some of that old scar tissue from that old rhomboid tear in here. Great job, Bree. I know if I was having Dr. DJ do this to me, I would be squirming way more than you are. You're doing an amazing job. Just gonna work into our suboccipital muscles, those muscles that sit right under the base of the skull here. A couple weeks ago, Jeremie was saying he had some fluid behind the ear that just wouldn't go away. And after we did a little bit of work here, I think you heard him say it popped, and he really hasn't had too much of an issue with it since.
Correct.
Which is great.
A lot of relief from that. Thank you.
Of course. Getting a little bit into the scalenes here, kind of on the side of the neck. So I'm strapping in Jeremie's legs to our table right now, and I've asked Dr. DJ to give me a hand today. We're going to be doing a Y-axis maneuver on Jeremie. His levator is still pretty angry, and with the Y-axis just opening and distracting everything up, it's going to help release all that neurology going to the levator.
The levators being postural muscles, commonly they adapt and wrap around when there's a decreased disc space going on. Every inch our neck is forward, which is a lot of times when we're playing the drum, sometimes when we're sleeping wrong, when we're on the computer, every inch adds about 10 pounds. So whenever you see someone, they have about a 4-inch lean there, 40 extra pounds of compression are coming onto their neck. So those postural muscles, they have to grip up to just protect the area. And the big thing we want to do is release all that disc and compression to allow them to release as well. Jeremie just slightly lift his head for me and slide right under his hair there. Then we'll get a nice good grip and relax that right back down the string. Get a nice good grip around his mandible here and we'll get a good release through there. I'm gonna have him take a nice big breath through his nose. Yep. Letting all that air out. I'm just gonna relax right into this. There we go. Perfect.
Awesome.
Oh, I felt that.
Yeah, oh yeah. Right between those shoulder blades?
Yeah.
Exactly what we're going for.
Perfect.
I want you, man.
Take your time, man.
It's a
Please
big
relax.
release, yeah.
We always like people to take their time getting on up.
Wow. Yeah.
Big stuff,
Thank
man.
you.
For sure.
Job, sir.
No problem, brother.
Woo.